Let's go over how to foam roll. So we're going to first go over some basics in terms of something you can apply to wherever you're trying to foam roll, so then that way you can make sure that you're getting the most out of it.
What we like to talk about is how to know where you should roll first and how to go about making sure that you don't miss out on an opportunity when foam rolling. An analogy that we like to use is more of a canvas and a paint roller. For the purposes of you knowing how to foam roller, we're gonna cover my front of my leg or my quad in this case. If all you did was just focus on one aspect of the front of your leg or your quad, you might miss some of the corners that wrap around towards the inside or the outside. So if you think of your body part as a blank canvas and the roller as a paint roller, what you should do is cover the entire canvas with paint. Don't miss anything with the roller, and you won't miss an opportunity to help yourself with it.
You want to start by choosing a body part. So you can choose something like your quad, your calf, back of the shoulder, through the glute, something like that, but you want to stick to one body part before moving on to another part. So you want to try to do something like 1 to 2 minutes per body part instead of just kind of moving all over the place, because then that can ensure that you're getting the most out of it.
So now that you know where you're going to roll and that you are going to cover all of that area, what you need to do is keep in mind that the movement, the action of rolling is how you're searching or finding where you need to be. Holding on that spot that you find, that trigger point, that knot, that lump, that spot that's more uncomfortable, holding on it for 30 seconds or longer is how you actually get it to go away. If all you're ever doing is moving and you're not holding long enough on one spot, you're actually missing out an opportunity to get rid of that knot. So scan and search and then hold for 30 seconds or more.
So if we're keeping with that painting analogy, John is going to be foam rolling through the front of his quad. So he's going to first scan through an area for 1 to 2 minutes. The objective is going to be to get the outer portion of the quad, the center, and also the inside.
When trying to figure out the boundaries of where you're going, you don't want to roll over bony points. So I'm not going to go over the front of the tip of my hip here, the pointy part, and I'm also not going to roll over my kneecap. Those will serve as like the south and north borders of where I'm going. But then also when I'm covering my thigh like a paintbrush, actually the seams of my jeans, if they're visible, are really great in demonstrating everything I'm going to cover to completely cover the front of my leg.
Okay, so he's going to go kind of in like a front plank kind of position, because this will make sure that he's getting like the most force through that quad, as opposed to say if he's like more turned open. So for this first 1 to 2 minutes, he's just going to scan through through that entire quad. So you see how John is turning his leg. If you notice his right foot, so he's like kind of turning those toes out to the side, then they go to the center, and then toward the inside. That's making sure that he's getting that entire area of the quad. So once he's done with scanning through the quad for 1 to 2 minutes, then he can start to focus in on some areas that were a little bit more stiff. So if he has found, have you found a spot there?
Yes.
So yeah, because he's found a spot there, he's going to hold that, and then what he can do is he can bend and straighten his knee, because this will be really helpful for kind of untying that knot a little bit more.
But know that this might be like more of a step 2 once you're more comfortable. This can add a lot of discomfort in the immediate. So if all you can tolerate is holding, just hold your leg there. But if it feels like it's good enough or getting better, you can add movement or at the knee to get a little bit more out of holding.
Mm-hmm. And what I'll say too is don't skip the scan just to be able to get to one area where it feels tight. Like, so if like as you're going, when you immediately start, you're like, this really hurts, and then you start doing this bending and straightening, because there's actually value to getting that whole part of the quad to move a little bit better, because it's going to alleviate some of that tension in some of those more focal spots.
You can apply the system that we just gave you to any part of your body. On our channel, we'll go over more specific areas, some of the like less usual areas like your lat under your arm and other areas like that where it's not as simple as the front of your leg. But for the most part, the majority of what you need to roll, you can apply just what we gave you.
Make sure to like and share this video so then more people know how to foam roll properly.
Thanks for watching.